So what are some of the common complications we do see with skin cancer surgery? And yes, they are going to happen. No one's going to have a zero complication rate. One of the most common complications in surgery is bleeding. And it's important to control bleeding at the time of surgery, but also have a plan of action of how to manage bleeding if it occurs after the surgery. A hematoma will cause a weak wound, will cause wound dehiscence, will cause slower healing, and if you can manage the bleeding at the time of the surgery, that helps minimise that complication. And a very simple way of helping manage that is ice. Cold water is very effective at giving pain relief, but also minimises bleeding after the surgery. If you're giving your patients clear instructions about how to use ice on their surgical wound after the surgery, you can decrease the rates of bleeding complications. So one of the common complications for surgery is infection, and everyone's going to have an infection rate. It shouldn't be 20%, but it will be something like 1 to 2%, which does mean that at least 1 in 50 of your patients will get an infection of the wound. They are easy to manage, but the important thing is to manage them early. So first of all, give your patients instructions about what to look out for. If they have increasing soreness, if there's smell, discharge, ask them to come back so you can review the wound. Give them permission to come back is important so they do so. They don't want to bother you sometimes. They're worried that you're an important person and they think that they are wasting your time. So definitely give them permission to come back is an important thing to do. If we manage infections early, they're easier to fix. Sometimes it does actually involve opening up the wound partially or completely and removing discharge and pus, but other times it's just simply oral antibiotics. Again, the earlier they are started, the easier it is to manage the wound.